What are three things we can do medically every year? Is it just check with the doctor once a year and do some tests? Or what would you say are three things, whether it be see a doctor, take this test every year to at least have like a baseline of understanding of the information about our bodies, you know, our blood work, I guess. What are those things we can do that you were like, this is a bare minimum, do these three things?
All right. So the best predictor of your long-term longevity that we know of is your blood sugar. And there's a readout called HbA1c. HbA1c.
HbA1c. What is this?
Ask your doctor.
Okay.
It's the amount of glucose that's become fused, attached to your hemoglobin. And when you've got high blood sugar, it attaches to a lot of proteins in your body. You become caramelized. And hemoglobin you can measure in a blood test. And HB stands for hemoglobin, and A1C is the version that's got sugar on it. And doctors measure this routinely for diabetics, but they don't measure it routinely for regular people. But you want to make sure, and the reason you want to measure HbA1c rather than just your fasting blood glucose, which is quite variable, is the HbA1c, it's a snapshot of a month, because your hemoglobin gets turned over every few months. So it's like an average of a month. Now you can do it with a monitor from levels if you want, but if you don't have that, then this HbA1c number gives you an idea. So if you're around 5 or lower, you're super young and healthy. If you're in the mid-range up to about 7, you're pre-diabetic, and above that, you're type 2 diabetic.
So having this information every year is important, is what
It
you're
is,
saying.
and not just every year. You can do it more often.
Every month, every week, every
Well,
month.
I do it every few months. Inside Trackers, I get it through them, and I'm seeing things go up, and as they go up, I bring them down.
You make adjustments.
I do. Yeah, I mean, that's the point of having this data. Otherwise, you get sick and it's too late.
Yeah. So having the information about this is a huge thing you can do a few times a year.
Right. And there's another one that I'd measure for heart disease, which is called HS, little hs, and then capital C, capital R, capital P.
Okay.
High sensitivity CRP. So this C-reactive protein is a good measure of cardiovascular inflammation, and you want that to be low.
How low do you want it to be?
I forget the units.
Okay, but you just want it to be low. Okay.
Yeah, and then there's a new type of cholesterol, not new, but new to the mainstream, called LP little a. It's a capital L, little p, and then in parentheses A. And that is the new measure of cholesterol. That genetic variance of that, if you have a lot of it, and it's a little particle, a really small particle, then it'll oxidize, and that's what likely predicts your heart attack of the future. But most doctors either don't know about it and don't measure it routinely. LP little a, talk to your doctor.
And what are the 3 supplements we should be taking on a consistent basis that you
Well,
take?
I don't recommend anything. I'm just a PhD.
Okay, what are 3 things that you want to take consistently?
Yeah, if I could only take 3, I would take resveratrol. I take 1 gram with a bit of yogurt. NMN. We haven't talked about NMN. And then metformin.
NMN.
Yep.
It's a supplement.
It is.
Okay.
I don't sell any supplements, by the way.
Gotcha.
I'm not making any money here.
But you would take these? Yes.
I would, because our research has said that that's what works. In animals, at least, in some clinical trials, we've done plenty of studies and others in resveratrol, long-term benefits. I've been on it for 13 years. Activates the genetic pathways we've worked on. Controls the epigenome.
Yep. NMN.
NMN also activates the same epigenetic structures.
Okay.
It makes them stay young, we think.
And the third one again?
Metformin. This is the type 2 diabetes drug that controls blood sugar.
That doctors aren't able to give out right now?
They're reticent, but they can if they want to.
Interesting. Interesting.
I believe there's a website online. Check that out.
What's it called?
I don't remember.
Okay, but Google
You
this.
could Google it. You'd see it.
Interesting. But these are the 3 things you would take daily if you could only take these.
Right now, I mean, I've got some other things in the hopper that I'm trying.
Right.
The alpha-ketoglutarate might be promising, the age reversal one, see if that's got merit.
You're trying all these.
Well, I add them one at a time or two at a
Yes.
time, and then I measure. It's all scientific.
Interesting.
And so I've optimized myself. You can actually, I've got graphs where you see a 20-year-old's numbers on average, a male, and an 80-year-old's numbers. And where am I? I'm trying to be down here. And
Yeah.
mostly,
30, yeah.
so far, so good.